All right. Hello, everyone. Welcome to our conversation today, From Risk to Readiness, a smarter way to prepare for opioid overdose. My name is Claire Bryant. I manage our workplace well-being initiatives at the National Safety Council, and I'm really excited to have this conversation with you all today. We're launching a new tool that you might have seen, our Overdose Emergency Planning Tool. So we're going to dig into the scope of the overdose crisis and a little bit about how that tool works, and then most importantly, talk about how we created the tool and the research behind it, so you can understand our process to create the tool itself. So before I dive into some more of the specifics, just a few housekeeping items to note. Feel free to use the chat to say hello, to introduce yourselves, where you're coming from, whatever organization you might be associated with, and connect with your peers. We were planning to use the Q&A feature for all of the questions. Unfortunately, it's actually disabled, so you can also use the chat to utilize that for any questions. We will have two different segments of the conversation today that will be specifically for Q&A. And as always, we will share the recording of this webinar afterwards. So we'll send a post-event email that will have a link to that recording that you can access for yourself or to share with others who might have missed the conversation. If you're not familiar with the National Safety Council, we are a national nonprofit that's been around for over 100 years, with workplace safety and roadway safety really being our bread and butter. We're a member organization. We've got over 13,000 members. And if you're interested in learning more about our member exclusive resources or our freely accessible resources, you can go to nsc.org to learn a little bit more. Today, we're really going to be digging into one of our programs specific to naloxone in the workplace called our Respond Ready Workplace Program. If you're not familiar with what naloxone is, it's an opioid overdose reversal medication, and Narcan, one of the common brand names, was recently made over the counter in March of 2023, which really spurred us to create an initiative to help support organizations to get access and obtaining naloxone for the workplace safety programs. So we help to increase awareness about the overdose crisis and what naloxone is, making sure that organizations can access it, particularly through our partnership with Emergent, who funded the Overdose Emergency Planning Tool, which we're very grateful for, and then also creating adoption resources, making sure that organizations have tools and resources to help create implementation in their own organizations. So here's the landscape for how we're going to go through this conversation today. We're going to hear from Emergent Biosolutions to kick us off. I'll provide a little bit more overview and context on the overdose crisis, and then also give you a bit of a preview on what the new tool looks like that I just mentioned. And we're going to spend the bulk of our conversation with our partners at EHS Compliance Services because they led the research that helped to create the tool. So they're really going to take you through all of our methodology and findings and how it led to the tool itself. And this is where we'll take our first break for Q&A. Since this part will be a little bit more technical, so if you have any questions about that work, that would be a great point to add your questions into the chat, so we have some time there. And then we'll finish our conversation by getting started on creating an opioid overdose response and preparedness program within your organization. And we will hopefully have a little bit more time at the end of our conversation for any other questions that you might have. So first, to launch this conversation off, I'm going to welcome Lindsay Arnold to the stage. Lindsay leads Global Public Health Affairs and Policy for Emergent Biosolutions Incorporated, where she works with advocates, third-party organizations, and policymakers to help expand access to and knowledge about naloxone in North America. Lindsay has worked in a variety of industry and government roles covering mental health, pharmaceutical development, and reimbursement policy for over a decade. She is a proud graduate of the University of Michigan, Ann Arbor. Lindsay, thanks so much for being here.
Thank you so much, Claire, and thank you to all the National Safety Council members for joining us this afternoon. For over 25 years, Emergent Biosolutions has been researching, developing, and manufacturing vaccines and therapeutics that address some of society's most pressing health and preparedness threats. We work with governments, NGOs, and businesses to deliver protective and life-saving solutions for health threats like smallpox, botulism, Ebola, anthrax, and what we're here to talk about today, opioid overdose emergencies. Emergent is the manufacturer of Narcan nasal spray. Narcan is a form of intranasal naloxone designed to rapidly reverse the effects of a life-threatening opioid overdose in just minutes. We're working tirelessly to get Narcan into more schools, workplaces, and other public spaces to help save more lives from opioid overdose, and our partnership with NSC has been a key component of that work. The range of first aid kit and emergency response regulations across different regions and industries make workplace-specific risk assessments for opioid overdose critical to implementing a naloxone response program. The Overdose Emergency Planning Tool, which NSC and the team is going to walk through today, will provide employers with a framework for assessing their risk and considerations for determining how many doses of naloxone your workplace should consider obtaining. NSC and Emergent entered into a partnership to co-develop this tool, and while Emergent is extremely proud of the work, the research, design, data collection, and interpretation was all independently conducted by the wonderful team at NSC. So with that, I thank you all again for joining us and the NSC and the rest of the team for the tremendous work on the tool. Let's dive in.
All right. Thank you so much, Lindsay, for those remarks. And as you said, we can go ahead and dive in. And to do that, we're going to start with a poll. Jenna, if you could go ahead and help us pull that up and launch it. I'd love to know how many folks here have actually provided naloxone as a component of your workplace safety programs already. So it's fine wherever you're at. We're just kind of curious to know if this tool is something that you might be able to utilize to help create a program, or maybe it's something that will be more beneficial for you to utilize to maybe readdress how many doses you're providing, or add in other layers to amplify your program, or to add in other kinds of considerations like recovery-friendly workplace policies, perhaps. All right, I think it looks like most folks have had a chance to add in their responses, so maybe 10 more seconds here, and then we can share the results. So far, I'm seeing mostly a split, lots of yeses and nos, and a few folks are unsure. So Jenna, if you can go ahead and share the results with the group. All right, so you should be able to see those results on your screen right now. We've got 51% of folks on the call that have said that they have naloxone as a component of safety programs, 40% no, and then a few, 9% specifically, who are unsure. So that's helpful information to ground us in our conversation today. It looks like we've got a lot of folks that are prepared with naloxone. Maybe you're looking to know more information about other ways you can amplify and strengthen your program. And many as well who might not have naloxone or don't have naloxone. And I'm confident that this tool and this information will help you to be able to consider and add it into your organization's policies and programs. So thank you for sharing that information with us to get us warmed up. I do want to start just to tee up the conversation with our partners at AHS Compliance Services with a little bit more context on this conversation. All of us have really heard about the overdose crisis or the opioid crisis, but it's continued to evolve over decades that it's been impacting our country. Right now, we've seen about 80,000 deaths from drug overdose in 2024. This is a very staggering number. It's the leading cause of preventable death in the United States. And it's also the leading cause of death in Americans aged 18 through 44, so our primary working age population. And it's double the amount of car crashes that we see on an annual basis, just for comparison. And so while this is a very large number, believe it or not, it's actually a pretty significant decrease from the deaths that we've seen over the past couple of years, particularly due to the impacts of the pandemic. Those numbers were north of 100,000 for a few years in a row, so we're excited to see some declines here. But we have a lot more work to do to continue to decrease these numbers, and also to make sure that we're equitably addressing the overdose crisis, because while we've seen general decreases in our overall population related to overdose, we've seen increases in some demographic groups and also different areas of the country. So again, lots more work to be done to continue to double down and create impact to continue to decrease these deaths. And one of those ways to do that is particularly by investing in naloxone and opioid overdose reversal medications. And so just to look at the workplace lens here, we've seen comparable trends in the workplace as we've seen in our communities. Over a 600% increase, in fact, in deaths that have occurred on the job from the numbers that we get from the Bureau of Labor Statistics. And just as we've seen in the community level data, we've also seen slight decreases in the total deaths each year in the workplace. And so hopefully we'll continue to see these declines once we get our 2024 numbers, which we don't quite have yet. But we know that the workplace is a microcosm of society. So anything that's going on outside of our literal or figurative walls in our organizations will, of course, be impacting our organizations. So it's important to keep a pulse on things that are impacting our communities, because it's our job as safety professionals and allied professionals that are working on this work to make sure that we're prepared for overdoses, as it is a primary risk for all of our communities. And specifically, we know that overdoses account for 10% of workplace deaths. And to further contextualize this, we've done some research at NSC in partnership with NEMSIS that tracks EMS-related incidents and exposures. And we've found through this data set that naloxone was actually utilized over 35,000 times in workplace opioid overdose responses from 2022 through 2024. So I think that really helps to demonstrate the magnitude of the opportunities for preparedness for overdose in our organizations. So of course, our topic of today is talking about how we actually can integrate naloxone into workplace safety programs, being a primary safety mechanism for your first aid or emergency preparedness programs, really akin to any other kind of preparedness efforts that we embark upon as safety professionals or public health professionals. It's an evidence-based intervention. It's been available over the counter since March of 23, like we discussed earlier. So it's a lot easier now to actually adopt this tool than it has ever been before. But in the research that we've done at NSC, we know that there's still a pretty big gap. And I know about 40% of this group is perhaps looking to adopt naloxone that doesn't already have it. So that is why we have really focused on our Respond Ready Workplace initiative and partnering with others who focus on increasing awareness and knowledge and information about naloxone in organizations. And so that is why we created this new tool, which we're going to be diving into in more detail in just a moment. You can feel free to go to nsc.org/overdose tool. If you want to poke around and explore it for yourself while we're talking about it, you're welcome to do that. It's called our Overdose Emergency Planning Tool, and it is a free tool that you can find on our website to estimate how much naloxone we recommend based on the research that Leslie and Kalila are going to share with us. So before I hand over the torch to them to dive into the methodology and the research, I did just want to show you what the tool looks like to help connect some of the dots as they go through their material in case you're not able to pull it up on your end. So this is what the front page or the home page will look like. You can add these inputs in, and these are specifically tied to the findings from the results to make sure that it's information that is very tailored to your organization and your specific risks and needs. So you can add all of that information in, and you can add your email address in. This tool is applicable to organizations in both the US and Canada. So once you add in your country, you'll be able to add in your specific state or your province. And you can use the tool as many times as you need. And this is what the results page looks like, just the very top component. So the primary information that's shared at the top is the recommended or estimated number of doses for your workplace. And then you can drill into the specific details based on the inputs that you added into the homepage to help you understand how that number was recommended to you. And then additional sections that you can find in the tool include more information on naloxone itself in case you're not super familiar with what naloxone is. Placement and storage considerations, we get a lot of questions about that. So there's a little bit more detail there to help you understand what to do with the naloxone once you've obtained it. And also relevant laws. For example, California is now requiring naloxone in workplaces by 2028. So if you're in a state where there's any relevant laws or bills to consider related to this, you will find that information there. And some other resources that NSC's developed through our Respond Ready Workplace initiative. So with that, I'm going to welcome to the floor Kalila and Leslie. Kalila Goya is the CEO and principal consultant at EHS Compliance Services, Inc., a consulting firm that helps industrial enterprises protect workers, the environment, and corporate reputation from organizational risks. She has over 25 years of experience in the environmental, health, and safety industry and has been at the helm of EHS Compliance Services, Inc. for nearly 15 years. EHS Compliance Services supports multinational organizations through a suite of services that focus on regulatory compliance, worker well-being, and risk management. Her team has partnered with Oracle Corporation to develop an occupational health and safety software solution and supported EHS projects with biotech giants like Genentech and AbbVie. She recently led the creation of a worker well-being education initiative for over 150 people leaders at cosmetics industry powerhouse L'Oreal. A certified hazardous material manager and certified safety professional, Kalila is regularly featured in industry publications and is a highly sought speaker on topics including sustainability, mental health, accessibility, and inclusion. She has delivered talks for the American Society of Safety Professionals, the Safety Center, the Cal OSHA Summit, EHS Today, Velocity EHS, and the National Safety Council, to name a few. She is the author of EHS Professionals Elevate Your Impact Through Integrating Psychosocial Hazards, featured in Leader. A champion for EHS integration, she is the recipient of the 2021 ASSP President's Award and was featured in the inaugural edition of the EHS Daily Advisor's Faces of EHS. Inspired by the evolving intersection of EHS and the future of work, she is committed to embedding environmental health and safety excellence into daily operations of every organization. Outside of her work with clients, Kalila dedicates her time to mentoring emerging EHS professionals and consultants, practicing yoga, and exploring the world with her family. Thanks, Kalila, for being here. And I'm also going to quickly introduce Dr. Leslie Hammer, who will be joining Kalila for this next portion of the conversation. Dr. Leslie Hammer is an occupational health psychologist with over 30 years of experience consulting and researching workplace mental well-being in a variety of industries, including military, academia, high-tech, healthcare, construction, and grocery, to name a few. Dr. Hammer is director of the Oregon Healthy Workforce Center, a Total Worker Health Center of Excellence. She is also Associate Director for Applied Research at the Oregon Institute of Occupational Health Sciences, Oregon Health and Science University. She is a leading international expert on promoting and protecting workplace mental well-being, safety, social connectedness at work, resilience, and the prevention of occupational stress. She has extensive experience designing, implementing, and evaluating worksite well-being programs and evidence-based trainings for leaders, managers, and supervisors that increase resilience, engagement, health, and well-being that impact organizational outcomes such as turnover, productivity, and absenteeism. She has received over $20 million in grants from the NIH, CDC, and Department of Defense, and has published over 100 peer-reviewed research articles. Her research has also been cited in outlets such as Newsweek, Mashable, HR Brew, Safety and Health, and Health Central. She is the author of Working Couples Caring for Children and Aging Parents, Effects on Work and Wellbeing. Thank you, Leslie, for being here with us. And I'm going to go ahead and turn over the floor and stop sharing my screen so you all can share your slides with the group.
Awesome. Thank you so much, Claire, and thank you, Leslie, for being here to present with me today. It is a joy to have you all joining us. Earlier this year, as Claire shared, the NSC released a request for proposals to seeking experts to support the development of this tool, to estimate how much naloxone workplaces should have on hand. And we were thrilled to support this and to be chosen to do so. So the goal was to provide inputs to overdose emergency planning that would guide organizations based on identified risk factors, filling a critical gap because there are no formal standards that currently exist. So EHS Compliance Services was honored to be selected because this aligns with our mission of helping industrial enterprises reduce preventable harm through embedding EHS excellence into organizational operations. And so we were tasked with facilitating expert focus groups, analyzing the findings, and co-developing the formula and methodology that now power the tool, which you're going to hear a lot more about shortly. So can you bring up the next slide, Leslie?
Yes.
Thank you. So to deliver this important work, we assembled a multidisciplinary team. So you've heard about me and you've also heard about Dr. Leslie Hammer. My responsibilities were the project lead, overseeing the engagement and integrating environmental health and safety principles into the tool, as well as helping with the report. Dr. Nicholas Smith, who isn't with us today, is also an occupational health psychologist with deep experience in qualitative and quantitative analysis. And he led the data synthesis and modeling for this project. And so shout out to him. And then I don't really need to introduce Dr. Leslie Hammer. You heard her amazing bio. I'm honored that she decided to join me in this project as our lead researcher. And so without further ado, I am going to turn it over to her so she can walk through the methodology.
And you're first going to actually do a poll.
I'm first going to do a poll, yes. So since the tool has been out for quite a little while, we would like to know if you have tried the tool. And so I think Jenna's going to bring up our poll now. And so if you could go ahead and let us know if you've used it or not, we would really like to know, to get a feel for if you've had an experience with the tool. And so I'm not able to see the results on my end. And so Jenna, I'll let you kind of decide when to bring it down based on the responses. Awesome. Amazing. So it looks like about 23% of you have tried it. So thank you for that. We'd love to see in the chat any thoughts that you have that you'd like to share. Some about 2% says yes, a lot. So only 2% have used it a lot. And we've got about 74% that have said no. So hopefully this will help you, number one, understand the background, but also how to use the tool moving forward. So now I think I'm officially turning it over to you, Dr. Leslie.
Awesome. Okay, super. Well, thank you so much. This has been such an interesting and important project to be involved in, and I appreciate both National Safety Council and Kalila and her firm for including me in this project. As Claire shared, I am an occupational health psychologist. I'm also an industrial organizational psychologist, and I have been conducting workplace research for a very long time. And I have currently my role is the director of a Total Worker Health Center of Excellence. It's funded by the National Institute for Occupational Safety and Health. And the overall focus of what I do is really to understand how to make the workplace healthier and safer, and improving well-being of workers. So this project is completely aligned with my own work and my own values. I was pleased to lead the research conducted in collaboration with Nick and Kalila. And what we did was, I'm going to kind of just walk us through briefly the process. And I also want to mention that there is a methodology report that is available. You can download it from the actual site where the tool is located. And I believe Claire is going to put a link in the chat so you can access that methodology report, because I'm going to be referring to that methodology report and it would be nice to have on hand. So I'm just going to just briefly go through the brief literature that we conducted, the review of the relevant workplace and relevant work sites, websites that we actually considered in this process, and then also talk about our expert-led focus groups. So to start with, we tried to conduct a literature review, and in the literature review of naloxone and of opioid overdose in the workplace is somewhat limited. So basically what we do know is there's almost no research on how to actually implement a naloxone program in the workplace, because this is so new. And what we did focus then on were what are some of the factors that contribute to potential opioid use and overdose in the workplace. And what we found were that there were some key factors, and specifically I cite several articles that you can see, and actually you can obtain this research at the end of the report, the methodology report. If you download that, there's a list of resources that are available from the research that we conducted. But there is nothing that was actually very conclusive. What we found, though, in general, is that psychosocial stressors and physical demands in the workplace were the two primary factors that contribute to overdose in the workplace. And so we kind of dug in with those factors in thinking about and understanding how they are related and connected to different industries. And that led us to the conclusion that industry was a key risk factor. And this is identified by Shaw, by Carnett et al., and others that have published both in the US and in Canada. What we also took a look at were some of the naloxone distribution models, and there's some research on naloxone distribution models, none, however, as I mentioned, that are in the workplace. That contributed to our understanding and knowledge around these issues. But basically, it was a brief literature review because there's not a lot of literature that suggests factors that are definitively related to naloxone overdose in the workplace. So in other words, the conclusion was psychosocial stressors, the stress in the workplace, high demands, job insecurity. Those are examples of the psychosocial stressors. Many psychosocial stressors can occur in workplaces. We can talk about that a little bit later. But those stressors, along with the physical demands of the workplace, were contributors to overdose in the workplace. And that is because the high stress leads to potential use and overuse and overdose in the workplace, as well as physical demands in the workplace can lead to injury, and that leads to potentially to pain and pain management, and potentially then overuse of those pain management medications. So industry was a key factor. We will talk more about that shortly. We also reviewed relevant websites. We reviewed the Centers for Disease Control and Prevention. We reviewed the Department of Labor and then the Public Health Agency of Canada. And these websites were useful for kind of national and provincial information. And ultimately, we were able to conclude general information from those websites, but that geographical location was a risk factor. The problem is that there's many factors that go into geographical location, and so it varies by zip code, it varies by province. We have lots of factors that go into geographical location, which makes it a little bit of a challenging factor to consider more generally. The next phase of our research was to engage industry experts. And we engaged, and we invited a number of experts in the health and safety field, in drug overdose experts. We engaged experts in safety, health, and well-being. And we invited approximately 31 experts to participate in 3 different focus groups, and we had a total of 18 participate. These were 3 focus groups that were conducted by myself and Kalila, and we developed questions based on our literature review. So we keyed in on those 2 factors of type of industry and geographical location. And then we opened it up and we asked the experts, what other factors contribute to opioid overdose in the workplace? And what are from your expertise? And these were in experts both in Canada and in the US. And we then transcribed those data and analyzed those data. And that's where Dr. Smith came in and was of significant help. So the results of the inputs from those focus groups combined with the literature were the identification of these 6 factors. Now, right now I'm talking about 6, and then I'm going to get into the specific details of 5 of those factors. Because remember, I said that geographical risk factors is a little bit complicated, so it actually was not used in the ultimate calculator that was developed. And I should say that our inputs were then provided to National Safety Council, and their experts then developed the algorithm that went into the calculator. So we did not develop the algorithm. We developed the inputs that were important for the algorithm, and then that information was taken by the programmers to develop the algorithm. So I'm going to expand on these risk factors, so I'm not going to talk about them right now. So as I said, the calculator was based on 5 of those risk factors: proximity to naloxone, distance to medical care, industry and job risk profile, public access to the site, and workforce size. And I just want to remind you again that we will be taking questions after this presentation. And so feel free to either put your questions in the chat or hold on to them, and we will open it up for questions. So let's start with proximity. So what was revealed again, from our experts in the focus group is that proximity was a key factor to determining the number of doses that should be carried by a workplace. So naloxone within 2 to 4 minutes was critical because of the time that it takes for administration and the need for administrating as quickly as possible. Also considered in this factor were aspects of the workplace, including the number of floors, the location of emergency equipment, response bags, the total square footage of the work site. So ultimately, it was determined that proximity to naloxone was integrated into the calculator by capturing the number of floors and the approximate square footage. And we can expand on that further as we move ahead. And again, all of this is described in detail in the methodology document. Okay, the next factor was distance to medical care. And this is distance to EMS, emergency medical services, including response time, and whether or not there was available medical care on the premises of a work site. And so basically we identified high, medium, and low risk. High risk being within 10 minutes of a medical response. Medium risk is between 4 and 10 minutes of a medical response. And then less than 4 minutes is low risk, okay, within less than 4 minutes of a medical response. Okay, the next factor is the industry and job risk profile, as we mentioned originally, because that was a factor that was identified in the literature. That is the one factor that was identified in the literature. And again, the key characteristics that go into this are the amount of psychosocial stressors that are part of the job and part of the industry, as well as the physical demands of the job. And so we identified in the list of industries by level of risk factor is also identified in the appendix in the methodology report. But as an example, these are examples right now that we have, but the high risk industries include construction, for example. Medium risk industries include warehousing. Low risk industries, administrative, office space. So these industry risk profiles, again, are based on the combination of psychosocial stressors and physical stressors. The next factor is public access, whether or not the workplace has any access to the public. And this is because if there is access to the public, there's also the possibility of the public experiencing an overdose and within the workplace. If the public comes into the workplace, such as transit workers, such as retail, then we also have to take into consideration the fact that the public may experience an overdose within the setting of the workplace. So public access to the site puts the organization at high risk, or the industry at high risk, okay? And then the that really means just the open access and being able to come in. So as I said, transit, retail, the hospitality industry. Medium risk, where there's limited or scheduled access to the work site. That may be more like healthcare facilities, for example. And then low risk is when there's no public access to a facility. So there's no opportunity for the public to interface in the workplace. So this is another factor that went into the calculator. And then finally, we have workforce size. And workforce size, basically, there's lots of factors that come into play with workforce size. And we also have to consider when we think about size, we're talking also about when we think about work from home versus work on the premises. All right, we need to consider the number of people who are actually working in the workplace. So there are different recommendations that came up, and they varied quite a bit. But they varied ranging basically from 2 doses per 25 workers to about 2 doses per 50 workers. And so our recommendation here was that 4 doses were available at the work site for every 100 on-site workers. And this is also based on not only the input from the experts in our focus groups, but also the ANSI first aid standards, as well as the CSA first aid kit standards. So again, 4 doses per 100 workers. So I'm going to now turn it over to Kalila to kind of close us out.
Yes. Thank you so much, Dr. Leslie. I don't know why my camera's not working. Okay, can you guys see me yet? No?
Just about.
Okay.
There you go.
That was great. And hopefully that provided our attendees with the information they need to kind of understand the background of what we found in our research. And so again, we identified 6 factors in our research: proximity to naloxone, distance to medical care, industry and job risk profile, geographic risk factors, which were not included in the final algorithm, public access to site, and workforce size. And so these factors were validated through the qualitative and quantitative analysis, the expert focus groups, and our literature review. And so the resulting emergency planning tools designed to help you and your workplace make some proactive steps to incorporate naloxone into your preparedness. And so I'd love to open up the floor for questions. I think Claire is going to kind of moderate our questions. And I'd like to ask you, Dr. Leslie, because you have a lot of experience with psychosocial risks and psychosocial stressors and factors. And so with that extensive experience, I wonder, how do those, and you kind of alluded to this in, some of the discussion that you had earlier, but how do those intersect with opioid risk in the workplace?
Sure. And let me ask a question. Would you guys like me to take down the slides or leave them up? What would you prefer?
You can leave it up.
Okay, super. Yeah, so as an occupational health psychologist, and I primarily actually focus on those psychosocial stressors in the workplace, because what we know is that stressors such as high demand, stressors such as low control, stressors such as unclear expectations, those psychosocial stressors, and there's many more that I give full talks about, those psychosocial stressors contribute to stress experienced in the workplace, and that stress that people experience leads to all kinds of different outcomes. I study, for example, mental health outcomes, but what we also know is that stress can contribute to and lead to coping mechanisms, and sometimes those coping mechanisms involve alcohol and drug use. And so what happens is that high levels of stress are a risk factor for opioid use. And so we need to be paying attention to stress, and as well as risk, as I said, risk factors for mental health challenges, physical health outcomes. So psychosocial stressors are really becoming recognized as critical hazards in the workplace, in addition to physical hazards. And so they are now really seen as contributing, and as whenever we consider and look at injury, illness, and both mental illness and drug use in the workplace, we need to be considering those psychosocial stressors in addition to the physical hazards in the workplace. And those physical hazards, as I described, so these are both actually, they're kind of mechanisms that lead to potential drug use and potential opioid use. And so substance use disorder has been related to high levels of stress, as well as high physically demanding jobs, because of the potential injury and accidents that can occur, leading to having to potentially take pain medication. So that's sort of a roundabout way of describing the interrelationship between the psychosocial stressors and the physical hazards in the workplace.
Yeah,
And I'm
really
open to other questions. Are there other questions in the chat?
I think Claire is going to ask us some.
Yeah, thank you guys so much for the overview on the research that was conducted. And I just want to say I thank you guys so much in general for your partnership on this project. You're both very collaborative and very thoughtful about this issue, and I appreciate your excitement for doing this work with us. And we do have a question, two questions that actually have popped up in the chat. So let's dive into those. This specifically is for Dr. Hammer. From this study, do you believe that that leaders and managers need a total worker health perspective to be able to effectively distribute naloxone and for their opioid education?
I think a total worker health perspective is absolutely important. It's not that it's needed to have an important recovery responsive workplace, but it is very critical to really understanding ways of reducing injuries and also improving health and well-being in the workplace. And what that means is really paying attention to the importance of workplace programs and policies and how they are related to the reduction of safety, health, or the improvements in safety, health, and well-being. So yes, total worker health is very important when you want to consider the whole individual and the well-being, because we know that it's not just the physical hazards in the workplace, that there are also many other psychosocial stressors that come into play and that are really kind of the crux and importance in total worker health. Yes. Thank you for that question.
And so we've got a few others in here, not necessarily directly related to the research, but I'm going to throw them out there. And if you guys have any feedback, definitely let us know. So the first one here is, what legal issues have or have not been a result of use in the workplace?
Well, that's a really interesting question. Dr. Hammer, did you have something you wanted to share?
No, go right ahead.
Well, I think this is a part of emergency response, generally speaking. So as far as the US right now, outside of the legal requirements that Claire mentioned earlier, I haven't heard of any other legal requirements for naloxone in the workplace. But if we're talking about, the Good Samaritan laws and all of that, I think those are really specific to your jurisdiction. So I am not a lawyer or an attorney. So I would really highly recommend that you consult your local jurisdiction's regulations to ensure that you're complying with those. And if you're not quite certain, then I would suggest that you talk to your legal counsel.
Thanks for that feedback. And I can just add a little bit here that there's 49 states, with the exception of Wyoming, that have a overdose specific Good Samaritan law. So there is that level of coverage to make sure folks are protected from when they're using naloxone for any suspected case of opioid overdose. Naloxone has very minimal risks. But if you're not sure, it's okay to use it because of that protection. But as Kalila mentioned, it's always important to partner with legal partners here to understand your state specific laws. We do have a resource on the NSC website that goes into employer considerations by state that I can put here in the chat in just a moment to help maybe fill in some gaps there, because I know that's a question we get quite frequently. And we do have the section on the tool that is the legal recommendations piece. So if there is a state law, even if it's for specific worker populations such as schools, which is a more common one where naloxone is required, there's that information that you can find there as well. Let's see, there's another question in here. Is naloxone needed to is training needed to administer naloxone?
Well, it is advised that we give training for everything that we're going to do as a part of our emergency response program. And so I would say yes. And I know that that is also a part of the Respond Ready Workplace program. And so absolutely, we want to, number one, ensure that people know where naloxone is, where they can access it. They know how to administer it, the timeframes required, the storage requirements, and then how does that feed into your overall emergency response program. So I don't know if Dr. Hammer or Claire has anything else to add to that.
I can jump in and just add that, of course, yes, I agree. We want to make sure that workers are trained for all these different safety initiatives that we have. But naloxone is an over-the-counter product, so you can simply buy it off the shelf and use it as is. You don't need to have training to be able to purchase it and use it. But from a workplace safety perspective, absolutely, training is really easy to actually integrate. We have training at NSC. You can add it into your first aid training that you're already doing. So it can be a really quick and efficient way to integrate it with training that you're already possibly operating within your organization.
Yeah. And I'll just add that, I mean, right, training and really developing a culture of support around substance use and around recovery-friendly workplaces is very important. And so part of that does have to do with training frontline supervisors who can then communicate this value of importance and respect in the workplace. So that is part of the training, but also then training in the use is, it can be helpful, but it is not as described, not required.
Great, thank you for that context. And I see a few more questions in here that aren't necessarily direct to the research, so I'm going to pivot to a few that I have on my end that I think would be helpful for the audience to hear. And I think if we have time at the end, like we've planned, I'm going to come back to some of these questions at the end that are more general in nature about naloxone and creating programs and organizations. So I'd love to ask Kalila, actually, one of the areas that when we were looking at the research that you provided and trying to integrate it into the tool, one of the trickiest areas was proximity to naloxone, but it's one of the most important factors, like we've discussed in this conversation today. And so I would love for you to share with the group maybe how you were able to think about the square footage consideration for organizations that have varying levels of space, to make sure that we're considering accurately within the tool, how we're accounting for the proximity for naloxone within organizations. So can you cover that for us briefly here?
Sure, absolutely. Well, thanks for the question. And obviously, proximity was, I think, the number one factor. And so we really wanted to make sure that that was included. So obviously, proximity is really related to the number of floors at the facility, as well as the square footage. Like you could have a site that is, 1,000,000 square feet, but it's, horizontal or, vertical. And so looking into that. So unfortunately, there were, again, no peer-reviewed research or standards specific to a fixed constant. But what we were able to ascertain through some literature review was that a conservative planning estimate of walking speed of 2 feet per second in an emergency. And so using the good old physics, which I never thought I would use in my EHS career, we were able to kind of translate that to say if folks are walking, 2 feet per second, and they have between 2 to 4 minutes to get to naloxone and to get back to the individual to provide that dosage, that would give us an approximate radius of 180,000 square feet. And so that's how we considered, and that's a very conservative estimate, actually, because we're using the lower end of the time frame as well as the lower end of the walking speed. And so that's how we incorporated the square footage calculation, or at least recommended that square footage calculation be included in the algorithm.
Thanks for sharing that. Yeah, I was really excited
Sure.
we were able to find a way with you all to integrate that component more directly into the tool, to account for varying sizes of organizations, since every organization is particularly unique in that sense. Go ahead.
I was just going to say there were some assumptions with that, direct path to naloxone. We're assuming an instructed environment like manufacturing settings. And as I mentioned, we are using a conservative view. So, or conservative numbers and estimates for that. So again, all of that information I think is delineated in a methodology report for those of you who want to review that a little bit further.
Thanks for that. And I will say too, if you look at the methodology report and you have any questions for us, we, always are welcome to receive emails at wellbeing@nsc.org. And if there's questions that we can't answer and we need to phone in experts with Leslie and Kalila, we can connect with them too to make sure that you get that feedback. So there's full visibility to how we put this information together for the tool. So thanks for those questions. And I just have one more for the both of you. Just would love to hear your perspectives on what's something unexpected maybe that you learned from this research, whether that was the process itself or the findings from the methodology or from the results, excuse me.
Oh boy, something unexpected. I guess for me, being being a researcher, I was surprised the lack of research, the lack of actual, data on the relationship between kind of workplace factors and substance use. I mean, that's other than the two factors that I've been talking about, the psychosocial and physical, there really wasn't any additional information. And I think that there's a whole I think there's a lot of other unanswered questions that I have as an occupational health psychologist. I'm particularly interested in how leadership and how the leadership structure is impacts use in the workplace and what that looks like.
Thanks for that. And I apologize for the curveball, but I think that's a really good,
Yeah.
like a good answer, because there's such a lack of research here. And for any researchers who might be in the room, cue to you to help us kind of fill in that gap, since there's a lot of opportunities here to add to this. And also appreciate the folks who participated in our focus groups, because we really relied on those industry experts to help give us some really roots on the ground and boots on the ground perspectives on how this actually can look and be utilized in real time. So Kalila, would love to hear from you on your perspectives for my question.
Yeah, so I think the most interesting thing for me, I don't know if it was necessarily a curveball or something I wasn't expecting, but I was pleasantly surprised, I guess, by it, by the level of implementation of programs that the folks in the focus groups actually had done. So a lot of the focus group attendees had actually already created programs, and they had websites, and they had done some of their own research and assessment on what they would use as proxies instead of, or in lieu of non-existing standards and recommendations. And so that really helped us kind of come up with some of those risk factors. So that was pleasantly surprising. And then also, I mean, Dr. Hammer kind of echoed the fact of what we focus on in the work that we do, looking at physical and psychosocial risk factors and keeping those together and not necessarily delineating those all the time or separating those. And so I think this highlights the importance of both, and putting them together to make sure that we adequately address the risks in our organization and holistically address the risk in our organizations.
And
Thank you.
Claire, can I just add one more thing? I just wanted to make sure, actually, it's not related to your question. It's because I can't tell if what I'm posting in the chat gets out to all of the participants or not, because it says it's just to host some panelists. And I wanted to let people know that my institute, the Oregon Institute of Occupational Health Sciences, is hosting a webinar on November 18th and focused on examining the science of substance use and the business case for why employers should care. I tried to post a link to that. Maybe somebody else can, or maybe everybody saw it. So just wanted to let everybody know about that on November 18th. Thanks, Claire.
Thanks. Yeah, thank you both. That was a really nice way to cap it all up. And I really, again, appreciate your partnership on putting this research together. And I'm sure we'll have more questions as we work towards improving the tool, especially in light of the lack of research and a lot of the boots on the ground implementation that we're seeing, and definitely appreciate, because it's helping to inform these kinds of materials and information. So thank you again. I'm going to pull my slides back up just to wrap us up here, so we can cover a little bit more on how you actually create a program in case you're new to this topic area. And you've not been able to get started. I'm just going to cover some steps that we have at NSC created through an implementation guide that we've developed. So let me just make sure everything is popping up the way it's supposed to here. Okay. Can you guys see these slides? Can somebody give me a thumbs up just to make sure I'm not talking without any slides?
Yes, we can see them.
Perfect. Thank you for the confirmation. So the first step is not going to look very surprising to most of us that have built EHS programs or any other kinds of programs within our organizations. You want to take a step back and do some planning before you just jump right into your naloxone initiative. And so the first step is usually conducting a risk assessment. And the beauty of this Overdose Emergency Planning Tool is that you can use it to help you actually conduct that risk assessment to figure out how many doses that you might consider providing. And alongside that, you probably will need to have some conversations to get some organizational buy-in, especially if folks are not familiar with the state of the overdose crisis, especially in your particular community or state where you're working in, or multiple states that you might be operating in, to give a little bit of context for why these kinds of initiatives are so important. And then sometimes that entails setting up a working group so you can outline the specific policies and procedures that you'd like to outline before you're launching the initiative itself. It's also really helpful to make sure that you're having some initial education and anti-stigma related messaging with employees before you launch the initiative. So again, everybody's aware of the impact of the overdose crisis and why it's so important that we're having these conversations internally within our teams. And also it can help to set up some more comfort and psychological safety with folks coming forward if they're looking for support before we hopefully even can avoid getting to an overdose emergency on the job. This is also where you want to set your policy. We don't have a lot of time to dig into the specifics of this, although I'm sure there might be some questions here. I saw one of our partners shared a link to their implementation guide and also their policy resources. I think that's a great place to get started. We also have an implementation guide that I'll share a link to at the end that has some information about that and a template that you can use to set up your policies. which can be integrated into existing first aid or emergency preparedness policies or be a standalone. And then, of course, you want to actually provide the naloxone. So you can go back to the tool and figure out how many doses are recommended. And then you can obtain that either through our partnership with Emergent, who has discounted naloxone for folks that come through NSC, so that you can obtain that. You can also get it over the counter in pharmacies or retailers near you, and you can order it online. And in some cases, there's free naloxone that's available through communities, especially through some of the opioid settlement dollars that are available in different states. So that is definitely an option to consider if that's something you're interested in. More information again on this in our implementation guide. And we did talk a little bit about training earlier, so I won't spend too long here, but we do have a free e-learning that you can utilize. It's important to make sure, especially you're identifying who needs to be trained and how often that training should be. But at the very end of the day, whether you're using a community-led training or you're using a training that you found online, there's a lot of great resources here. You want to make sure that that training is covered, specifically the signs of an opioid overdose and how to administer naloxone. There's a lot of other information that you can include in this, but the bare bones of that training should definitely cover those two pieces. And then also specific procedures within your organization, such as how to activate your emergency response protocols. And then you don't want to let this sit on the shelf, so making sure that you're looking at your program, integrating product replacement plans and training requirements to make sure this is a continuous process. And you do want to be prepared for if the unfortunate event happens and you have an overdose on site, you make sure that you have those procedures set up in advance so you know how you're actually supporting the overdose victim and any bystanders of the event to make sure we're supporting them in their mental health. We also want to make sure that we're continuing to provide education outside of the naloxone training itself, but on the broader conversation of opioid misuse, substance misuse, and recovery supportive policies. So very quick overview of some of the steps that you can take, but we do have resources on our website, like I mentioned, that you can access. All of these are for free, including the training. So the resource on the left is our implementation guide. So it really takes you through all of these steps and different resources, including the legal document that I mentioned earlier that can also be found on this resource hyperlinked within there. And we also have some trainings that you can utilize related to overdose prevention. So our Connect to Prevent program is a training that really helps employees to connect with their loved ones about opioid misuse prevention, for example. So lots of great stuff there. And if you're looking for specific recommendations on resources, you can email us at any time and we can connect you to those directly. And I did want to mention that if you're interested in getting Narcan specifically through Emergent, you can contact Jenny Burke. And her email is listed here on the screen. And we can also put that out in the follow-up email coming out later today or later this week. So I know we don't have that much time for questions, but I will just go quickly to the chat to see if there's anything else we can quickly touch on. I know I saw a few things in here. Somebody asked about the cost of Narcan going down anytime, making it more cost effective for city municipalities to afford for their facilities. So I would recommend for this person who asked the question to see if there's a way that you can get free naloxone through your public health department or through local harm reduction organizations that might be supporting that effort if cost is a concern. The cost overall for the different products that are out there has gone down over the last year or so. So hopefully we can continue to see that happen. If you have any other questions, you can go ahead and add it to the chat. And if we're not able to answer it now, we can certainly send you a message via email. And I'm not seeing anything else, so I really just appreciate everyone being here for this conversation. I want to thank Emergent Biosolutions for their financial support for the tool and also their general collaboration in making Narcan available for workplaces, and also Kalila and Dr. Hammer for all of the work that they spent on this project with us to make sure that this tool was evidence-based and evidence-informed. So with that, have a good rest of your day and thank you for your time.